So after staying in the hospital for about 2 months last year, I needed to go to a rehabilitation center to actually help me get to walk again. And somehow, I guess due to insurance and things like that, I ended up at an AdventHealth facility. Now, while the facility itself did not have AdventHealth in the name, being a graphic designer and looking at the marketing materials that I was looking at around my room, I made an assumption that that was the case. So I asked one of the first nurses that came into the room if this was an AdventHealth rehab center, and she told me no. So, red flag number one off the bat, my physician not even knowing who she's working for. It's kind of scary. My second red flag at this facility was the fact that I had an IV in my arm that was supposed to be used for taking blood. And they insisted on taking it out. So they got a blood sample from me, which they told me they wouldn't have to redo at least for a while, only for someone to come back into my room the next day and tell me that they lost my blood sample. How does that happen? I have no idea. But of course, because of this, they had to retake it. Aside from that issue, I didn't actually get a lot of rehab done staying at that center. There were several times where my therapists were late to their sessions. The schedule was not very organized, and the facility itself was not really equipped to help someone in my situation. It honestly felt like I was staying at a nursing home versus a rehabilitation center. By the time I had to leave the facility to go back to the hospital for chemo, I felt like I hadn't really made much progress at all in the 7 days that I was staying there. I know it can also be difficult to try to be selective about what locations you go to seek healthcare because it can also depend on what is accessible to you and even what your insurance covers. This is also part of the reason why the whole big ugly bill situation is a problem, because the more hospitals and health facilities that close, the less access and options people will have when they are experiencing medical emergencies. All I know is that regardless of where you are, you definitely have to advocate for yourself as much as possible. Your life depends on it.